You know, it's absolutely amazing what people can do when they combine their time, their talents, and their generosity. It was just 5 years ago. This property was a barren piece of land when I spoke with Dr. McCaig from Indianapolis and his vision of providing a regional medical center for the campesinos, the small farmers who occupy this mountainous region of Honduras. And here we are, it's up and running and seeing patients. Some of the finest coffee in the world is grown here in the mountains above the clinic, which is down there on the opposite shore somewhere. If you have coffee in the fancy coffee shops in the United States, it's a good chance they come from plants like this. But as beautiful as this setting is, if you live up here, your access to healthcare and healthcare information is very limited. And this is why the clinic has proved to be such a valuable addition to this region of the country.
This regional medical center is unique, and it's unique for a number of reasons. First of all, this is not just a medical clinic. It's basically going to support public health. It's going to support a network of communication between mountain villages that heretofore have not had this type of a situation. It will act as a center for complicated types of problems dealing with the various specialties of medicine. We're going to have a dental clinic here. We will have obstetrical care here. We will do all of the things that are necessary to be done in such a facility as this. But more importantly, we're going to be reaching out into an outreach network that is basically around this particular area in maybe a 50 to 60 mile area up into the mountains and beyond.
Even though the center is not fully operational, volunteers from the Department of Family Medicine at Indiana University have an exciting program underway.
This represents a very fascinating project which on a couple fronts actually helps the people of Honduras and most tropical countries quite a bit. The old stoves that were used were ventless stoves where the smoke from the stoves that were constantly cooking would come into the cabin. And what we were finding medically is that there were a lot of pulmonary problems, a lot of lung problems, respiratory problems we were seeing. And so one of the public health things that was just a remarkable idea was to re-equip most of these homes with a stove similar to the one that they had used, but one that had a vent or a smokestack on it. And when we did that, as you can see in the background as far as the chimneys that now exist that never existed in these places, we now vent the smoke out. And what that is doing is it's twofold. The first is we're preventing people from developing lung diseases and inhaling a lot of the toxic fumes. And secondly, we're decreasing the amount of trees that are needed. It's said that a family of 6 in Honduras would have to use, in the old stoves, 28 trees a year. Now, it's felt that that number is down to 8 trees a year. And really, without intruding on their culture, we've been able to help them on 2 different ways.
While remarkable progress has been made during the last several years, there are 5 specialty care areas that need completed. We have the necessary medical equipment, but no place to put them. Would you or your organization like to help sponsor a room? If so, we would enjoy speaking with you.
Thanks for joining me on this quick tour of the beautiful lands of central Honduras and our medical clinic. If you or your organization would like to participate in this project, we invite you to contact us at www.row.org or write me direct, john@row.org, and I would be glad to fill you in with more information.